All right, so as shown on the agenda, we will begin our presentation shortly, followed with a Q&A and peer-to-peer discussion session. And we will end with our evaluation and upcoming events and adjourn at 4 p.m. Eastern Standard Time. Next slide, please. So our final presenter of the PATH Board of Directors workshop is Native Health CEO and NCUI's board president, Walter Murillo. Walter Murillo, member of the Choctaw Nation of Oklahoma, has been at Native Health for over 25 years. He has been the chief executive officer since 2010, and prior to that was the chief financial officer from 2000 to 2010. Walter currently oversees 185 employees, 3 clinic locations, and 2 additional WIC locations, over 47 programs, and a budget of over $26 million. He is currently on the board of the Arizona Alliance of Community Health Centers and the National Council of Urban Indian Health, and serves on many committees in leadership roles. Under Walter's leadership, the health center has grown from 70 employees to over 180, 3 additional sites, and funding from $8 million to over $18 million. He has increased services to address many social determinants of health. In addition to providing primary care, Native Health also provides behavioral health, dental, WIC, nutrition programs, home visiting programs, and literacy initiatives. Mr. Murillo believes in forming partnerships with private organizations and public entities, and to provide services to the AIAN population and other underserved populations in the Metro Phoenix area. So let us welcome Mr. Murillo with a heart emoji in the chat box. All right. Welcome, welcome.
Oh, great. Do I start now, Divya? Can everybody hear me?
Yes, we can hear you.
Okay, great. So, well, thank you. So I want to thank NCUI and the team for inviting me to make this presentation. I don't know that I'm the strongest one to make it, but we've certainly been growing, and that has meant that we have many challenges about facilities and personnel, and I'm happy to share our experience with you all. And so I just want to make sure that I also stick to time. So, you know, I think I've got a deck here, and I'll move forward with it. So the objectives for this is to supplement our knowledge about successful expansion planning and understanding the pros and cons of funding during COVID-19, and also, I guess, to have a peer-to-peer discussion at the end of my presentation. So a little bit about Native Health. We are a UIO, one of the original UIOs. We're in Phoenix, and we started in 1978. And as we originally were just a community health nursing program, and we had, I think, a staff of 3. And then we added WIC, and in 1996, the board of directors made a determination that they would like to, start clinical services, but also start to move towards HRSA funding as a community health center as well. So that required some decisions to be made about who we serve, what services we're going to provide, et cetera. So we received some funding from the State Department of Health Services through the tobacco tax and opened our first full-time health clinic. We had already been providing behavioral health clinic by use of the 4-in-1 grant from the IHS. Next. So as we progressed, I became the interim CEO in 2010 and appointed CEO in 2011. We really started our time of expansion. We moved from a building we had in partnership with 2 other nonprofits here in the city to our own site, and that really opened our eyes up to expansion, the real need for the American Indian population here in Phoenix, and our desire to serve them, and our ability to manage our organization in order to meet the high demand of services here in the city. So you can see we've partnered with several different organizations over time and opened quite a few facilities. So next slide. So when we start looking at success expansion, we first start with looking at location. We want to understand the demographic in the area that we're serving, because we are now a HRSA grantee, and that factors a little bit into where we go or what communities we serve. But we still are a UIO, and that's the basis of our existence and who we choose to serve. So what we want to understand is where the population in Maricopa County lives, and especially the American Indian and Alaska Native population. And we have been able to see through our own data where our patients are coming from, and also census data, and also data from our state Medicaid program and our Department of Health Services. So data is available to find out where your target demographic is living, and et cetera. And one of the other things that's important to know, at least that we've discovered in our time here in Phoenix, is that people come to us. We are in Phoenix a victim of urban sprawl in a very, very big way. But nonetheless, people from all over the valley come to us. And if you were to overlay our data of patients and their residents with, say, the census data, what we discover is the same pockets that the census reveals where American Indians, Alaska Natives are the same pockets where we draw our patients from. So we are a healthcare, health delivery destination for the American Indian, Alaska Native population here in Phoenix. So we also do an environmental scan of services when we look at the area. When we look at the data about where folks are living, we use HRSA, also ADHS and their data to find out a little bit more about the population there. You know, the level of insurance, uninsurance, because we already know that a large American Indian, Alaska Native population live in the area where we're trying to pinpoint, but at the same time, we also want to know what the other community looks like. What's the demographic? Say unemployment might matter, insured, uninsured, service availability for primary care and for dental and behavioral health are all important parts of looking at the environment, the geography of where we're planning to build a new site or to relocate an existing site. Next, please. So when we start preparing for expansion, we want to say what services we want to provide there. If it's moving an existing site, say a mile away, it's likely we'll provide all the same services. But we've recently, in the last 4 years or so, started a site in a suburb of Mesa here in Phoenix. And when we were doing polling from our staff, from our patients, you know, their primary concern was primary care and pediatrics, and also maternal OB services as well. So when we look at moving to Mesa or opening a new site in Mesa, dental wasn't high on the list, but certainly primary care and pediatrics were. So those were the services we wanted to start building our practices on, and that influences your construction and everything else, your licensing. So we define what services we want to include, at least initially, and then maybe make a timeline of services we want to add, you know, over time. There's also some other data that we can get from the CDC, primarily about HIV, you know, with the CDC focusing on well, a couple of whole states, I think Alabama, I think in Oklahoma, but the rest are basically metropolitan areas where there's high prevalence of HIV infection. So that data is important to know. And in Maricopa County, where we are, we see that way out in Mesa, in that Mesa area. So we know, and that's also from people of color, including American Indians, Alaska Natives. So that becomes the target of the CDC, which thinks it's a prime opportunity to focus our HIV programs, at least our outreach testing and case management services out there. So we do a lot of that. We look at the census for the zip codes as well. We also look at partners. We moved to the West Valley and opened a clinic with Chicanos por la Causa, a large nonprofit serving the Hispanic and Latin community here, Latino community here in Phoenix. And they were looking to do an integrated healthcare and behavioral health. And they offered behavioral health and also housing. So it seemed like a good fit to put our medical clinic there. We had a high rate of American Indians and Alaska Natives, and part of also our HRSA mission to serve the underserved. They were on the western edge of our population or our service area. So it seemed like a great partnership to put a clinic in with Chicanos por la Causa, and that became a great opportunity as well. We also have had other partners in expansion, managed care organizations like United Healthcare funded this campus of care. And that's one of the things that in that particular case with Chicanos por la Causa really allowed us to be the healthcare provider partner for this campus of care that included housing, it included WIC, mental health services, and other things. So then as we as partners put things together, it made transportation really an easy solution because we were all providing transportation. And so we worked as partners then to how do we centralize such things like that. But there's also problems with partnerships as well. We're on different EHRs. So it's not always, always very as clean as you like it to be. But the fact is that these services were available to a community that didn't otherwise have those services before. So, that was a great partnership. Next slide, please. So we start by preparing, after we've done all the homework on the data, the site, the services, we start to put together a budget. So this is, we are expanding our Mesa site. We already own the site, so this is for renovation, expansion of the site, and building construction. So this is really just our project for expanding a site that we own. So, when we look at projects, we face that whether we'll buy, sell, lease, and what the pros and cons of each are. You might want to take into consideration long-term trends on demographics. Look at the American Community Survey, every 5 years or in between census. Look at the census and trending. Here in Maricopa County, a lot of American Indians, Alaska Natives, there was a large concentration of American Indians and Alaska Natives here in the central part of town, where we grew up, basically here at Native Health. An IHS facility, a large IHS facility is located nearby, and also the Phoenix Indian School, the boarding school is nearby. So, but over time, as the boarding school is closed and people have, moved to town and moved around, what we found is that most of the population here in Phoenix, American Indian, Alaska Native population, has moved out towards Mesa, towards the East Valley suburbs. So when we look at what to do, we knew where to go, and so we purchased out there. But at the same time that's happening, there's a decline here in Central Phoenix. So we have to ask ourselves, is that an area we want to own a facility in? Or is it an area we want to lease a facility in? Long term, will we need to abandon it? Another thing that comes to mind is the value of the property you may purchase. Moving to Mesa was a fairly easy decision because of the population, but it was also a pretty easy decision because the price of land and also existing structures was pretty cheap. It wasn't a high dollar area to move to, and so that played into our factor of purchasing that site as well. So over time now, we decided to expand and add services to it. So what we're looking at here is our budget to expand services by adding facilities, some space in our facilities for new services. And these will include podiatry, optometry, expansion of our telehealth capabilities, and also putting a dental clinic out at Mesa. So with that, these are our costs. So we have our staff, administrative and legal services is important, but also architects and engineering. And you can see the lion's share of costs, of course, is in construction, line 9 there. So working with a developer partner, an architect partner, and we help do as good a budget as we can, especially given the current circumstances. So we have a total budget of $3.68 million. And one of the other, and I'll talk a little bit about this when I talk about pros and cons. So next slide, please. So this is our actual budget for a project that we just began about a month ago. So when we're preparing for expansion, we also think about marketing. When we're moving to a new location like we did in Mesa, they haven't had any service for American Indian, Alaska Native focused primary care, but we felt there was a need there. But we also need to start considering our marketing ourselves. And this is separate from the business plan. They coexist, but our board is very committed to serving the American Indian, Alaska Native population here. We understand that there's a lot of other community health centers committed to serving other underserved, uninsured, and uninsured populations around Phoenix. It's a very tight market for FQHCs. There's one like every other block. So having a culturally competent American Indian clinic is important for our board to put into any place. Around us in our central facility, I think there's 3 additional community health centers. Around Mesa as well, there's two additional ones as well. But that doesn't seem to matter to the population we intend to serve. And it's not just the American Indian, Alaska Native population. Folks seek us out. We are in a border state, so when the state makes punitive laws for accessing care, I think immigrants feel comfortable around us. We seem less governmental, so we see a big spike in, say, undocumented immigrants when the state or the county is putting their thumb down or making a political point about such things. So we know that we provide an environment of safe care for the people that choose to come to us. So the cultural competency message is important. Becoming part of that community is important as well. So we host an annual open house at our central site and now at our Mesa site, and it's open to the public. We give out free stuff, a lot of swag. Sometimes we have rides. Sometimes we have food. I think we always have food, but we do that every year in pre-COVID times in October when it's nice and cool during the Native American Recognition Days here in the Valley. So it becomes an annual event that people look forward to. At our last event here at Central, probably was in 2019, we had about 5,000 or 6,000 folks come through our Central open house. So that's very important. I think building the credibility with the folks you intend to serve is our number one priority in opening a facility. I mean, we can open a very nice facility, very clean facility, but people are reluctant to come, or people don't know that we're there, or people don't understand the nature of coming and whether or not they'll pay, whether or not they have insurance or Medicare or Medicaid. Those are all questions you're trying to answer in advance through your marketing campaign. Next slide. So in the pros and cons of building, buying, or leasing, one of the pros to a new builder to buying is that you don't need permission to add services or make changes. You're not sharing. There's not a dentist around the corner or in the same building that would object, or that has a lease provision to be the only dentist in the building if you want to add dental services. You're not fighting for space with other tenants in a leased building as well. So you don't have to ask permission to want to make changes to the building. You just need to be able to afford it. So, and it's got to be licensed as well. So I would imagine, since you're already there, the zoning for providing such things is already in place. So at our Native Health Mesa, we have about 70,000 square feet and 25,000 square feet in use for us. We lease, we do have some tenants. The Navajo Nation long-term care is a tenant. H&R Block is a tenant. We have a lab that's a tenant as well. So there's some other revenues that come in with buying and owning your own facilities. So what we determined was that there's some space there that we could use with our new ARPA dollars to expand new services to the community of Mesa. When we moved to Mesa, as I said, we started with primary care and also pediatrics. So now is the time to expand the services. We've built a pretty good practice, a pretty good rapidly growing practice in Mesa. So it's time to bring all of our services now to Mesa as well. And so we also need to make sure that we have a sustainable practice or sustainable programs, whether that's through third-party grant or other things. And it's not just about direct care services. We also have our home visiting site based out of Mesa, our long-term care case management based out of Mesa. We do a food distribution program as well. It also provided a convenient place for us to conduct our vaccine testing, our COVID testing and vaccine programs as well, in which we were able to quickly identify separate space within the facility in order to accommodate our COVID-19 interventions. So one of the cons about owning is it limits our funding. It takes a lot of your capital funding. If you have capital funding or money in the bank, you still have to finance these things and you still have to operate them. So the capital needed, the operating funds needed, really they could be used elsewhere. They could be used for other services. So you really have to make sure you know what you're getting when you own a facility as well. And also the risk of the practice may not thrive or grow. We may have made a wrong choice. Maybe Mesa was the place to be, but not that block or not that neighborhood or not that corner. So we've been fortunate that the practice in Mesa has been thriving and growing, and now it's time to expand. So in looking at owning a building, you also have to make sure that you're creating enough cash flow to provide for your debt service and also the maintenance costs of the facility. So that's a huge add-on to your expenses that you don't normally get when you're in a leased type situation. So next slide. So there's benefits to leasing as well. We lease our central site and our West Valley site. And long term, our board of directors has made a decision that we probably need to own, our central site because of it still has a large population of American Indians and Alaska Natives, but it also is still a destination for people that want to seek care because of the Indian Health Service facility that's in Central Phoenix. But on the west side, owning is less important. So leasing is just as well. So with a long-term lease, you have the ability to lock in your rates. And sometimes initially it'll probably be below market rates. And of course it accelerates over time, but the longer term lease you have, the better chance you have of paying very good rates, in the long term, even with the escalation. So your realtor should have a good sense of that. And I would always recommend hiring a professional realtor to negotiate your leases as well. So you also have a partner. If you find a good ownership group or management group in with a lease, they buy into your mission. It's central. I mentioned the 5,000 or 6,000 people we had at our open house, and the building management and ownership are very much attuned to what we want to accomplish for the community, and are very willing to help us with that. We also partner with them to provide security for our facility, and also that works very well with the building security. So you can create a partner with owner or management group as well when you're leasing. One of the cons for leasing is the cost. The escalation of costs may happen, from year to year, and you're locked into those costs over time. That can be a pro and a con. It's easy to budget a known amount, but also a con in that it may be trending the wrong way over time in terms of value. Also, you may not have the space you need. As we've grown and expanded our practices and services, we've taken more and more and more space, even at least space. So over at our central site, we started with 25,000 square feet, and over time, I think we're up to 40 or 45,000 square feet. And it's also real estate that maybe not used for a purpose that you may need it for. I'm sorry, I've got a dog and a mailman, so, and they don't like each other. But, we find ourselves using really nice space that we're paying a very high rate to rent, and we're using that for storage. And we just, kind of cringe when we think, well, should we be using that for storage or should we be using that for services? So, it's really important to keep your head around the value of the facility that you're leasing and use it to the best you can with services. So it's, that's always important to keep a handle on. Next slide. So this is our game plan for how we execute expansion. First, when I say convince the board of directors, it's not that we don't know, that they don't know or have put into the strategic plan that that we need to expand, or we're looking for to relocate in some cases. But once we do all the groundwork, we have to convince or make sure we provide enough data and all that I talked about to the board of directors so that they'll agree with you, with the staff who's been working on this, that it's time to move, or it's time to move into a new marketplace, or to move from lease to ownership. So having those details really will help you understand and also help your board to make that decision to move. Line up your financing. Talk to your primary financer, whether it's a community partner, a CFDI, or you're using tax credits or whatnot. Line them up, because you need your financing. Even if it's your bank as well, have some preliminary discussions that you're looking to move that way. And also have the business plan ready for once the program is built or moved. You know what you're doing in terms of sustainability, and also the marketing plan, as I discussed earlier. We use a realtor and have for about a decade in all of our moves, and they're very, very helpful. They get to know you and know your mission and really start understanding what fits and what wouldn't, and also will work very hard in bargaining with management and ownership in terms of getting some allowances for TI, getting some abatement from rent, structuring the lease the way that fits your business model the best. So I think a realtor is a very important partner, and also the architect and contractor is as well. Hiring a project manager. When we did some projects, we initially didn't have project managers, and they were fine. They were smaller, but as our projects have gotten bigger, we found it pretty important to have a project manager, because as we're running our day-to-day stuff, whether it's clinics or going to these IHS consultation Zoom calls every other day, we don't have time to put that stuff in front of our minds. And so hiring somebody to do that is very, very important, because costs can get out of control, timelines can get delayed, small things can turn into big things, and I think you need somebody's eyes on it all the time. And in addition to the project manager, we identify somebody in senior management, whether it's me or our COO, to keep an eye on it in general, because what may seem right to a project manager may not seem right in the overall to a senior staff member, and you can discuss these issues. It's just sort of a check in terms of having representation in on your expansion. Next slide. So when considering funding types, we've used several types. We did make an application for new market tax credits, but that's very competitive here in this market, and we've never actually been able to achieve new market tax credits. But you also need a partner in financing with those new market tax credits. So once that's done and they apply for them, you may or may not get them, but if you do, that's a good route to take. Conventional financing through a bank is always an option as well. We've been forced to do that because we've been in a tight market with new market tax credits, et cetera. So we've worked with our banks And actually, we've come to find out that working with more than one bank is important. Having the connection with more than one bank is important because they ultimately do compete for your business, and that may be reflective in rates and other conditions, and also the rapid availability of approval and things like that. So maybe even talk with more than one institution. But conventional financing right now with the interest rates at this point still reasonably low, I think is a good way to go as well. But also find community partners as well. As I mentioned earlier, United Healthcare put $25 million or so into that program, that community use of care program that we had with CPLC. They were putting forward money for that as well, and MCO. And also, we're funding our MESA program through the Department of Health grant that they're funneling through our county for capital expenditures. And so we applied for them, and we received the whole $3.7 million for our project, for the construction part of our project from the county, Maricopa County Department of Health. So community partners is a good way to find funding as well. HRSA has the construction dollars that come available from time to time. And that's, again, one of the benefits of ownership is that you can have a shovel-ready project. So when these funds and their availability get announced, then they start saying, well, it has to be shovel-ready. Well, it's very difficult to be shovel-ready when you're leasing facilities. But if you own a facility, you can always have a project on the shelf. You spent a little upfront money, say with an architect or a planner, and you'll have enough material to put forward to one of those HRSA shovel-ready opportunities, if you're a HRSA grantee. And now the IHS and the new allowance for use of construction or use of your funds for construction is also a new opportunity to consider. Well, right now there's not specific funds allocated. We were hoping for that with Build Back Better, and of course that's dead. And we're apologize for our state senator Sinema for not supporting that, but that really that hurt, and we let her know that, and that's important too. But the IHS now allows you to use your contract dollars for tenant improvement construction. So that's something to consider, but that also might be taken away from your regular maintenance and operations as well. So, and there also are some limitations to those dollars. I think that the OUIHP put out a Dear Urban Indian letter a couple of months ago outlining what those dollars and what that new authority means to UIOs. Next slide. So the architect and project manager should draft a timeline, and it should have all these considerations. Right now, shortages of supplies, staffing, the project size, the budget, permanent licensing. So we have a good opportunity to take a look at that next slide in the actual timeline. So this was our draft timeline on the next slide for our current MESA project. Maybe I lost everybody. Okay, there we go. So you can see we've started the project already. We've got funding. So the blue area is really where our project manager and architect are doing, and then we start permitting and bidding for the project. And you can see the construction is the longest line, but there are certain things to do that while during construction we can do. Order the equipment, get ready for that. But you could probably also do that when soon after the planning is done as well. If you're opening four dental chairs or 4 dental operatories, you can already be looking for dental chairs. But of course, you're going to need to store them somewhere or plan for a later delivery. So some of these things can happen more in parallel. This is very linear, but nonetheless, these are the activities that we see as part of our project management schedule. And while it looks like it starts in April of 22 and ends in August of 2024, this is really allowing for a lot of allowances of time. It could really take as little as 18 months, we think, is what we're hoping. Next slide. So while we're doing that, we're also considering how we're going to staff the organization. Because by its very nature, this is part of our expansion. We start expanding our staff and training them to our operations all along the way, especially since recruitment is very hard. If you're recruiting providers, when do you start recruiting for a doctor or a mid-level provider for a project that's going to open in 18 months? Well, you probably start recruiting right away. Because even if you manage to find somebody, there may be a 6-month delay in their ability to show up to start working. So with your professional staff, the sooner the better. Usually I would think at least a year or so, you start looking for them to when you're going to need them. With your other staff, I think start identifying staff that might want to relocate to that area, because we always like to put some existing staff into a new location because they already know our processes. So during COVID-19, there's a lot of different fundings and funding types that have become available. I think it's important to utilize those funds in the way that they have been appropriated. So all the funds have various allowances. Early on, it was strictly about mitigation, testing, et cetera. And then towards the latter part, and with the new allowance for construction, the PHS-SEF funds, which were, I think, the last bit of funds, had allowances for building and facilities expansion as well. So over time, thanks to the good offices of McCooey and the members, we made it clear to Congress that it's not just about testing, it's about continuing maintenance of our efforts for public health, and also that required facilitating facilities change. So Congress listened and made those allowances in the last round of funding, but they also did that in the ARPA round of funding as well. So, be aware of your ability to use those for facilities as well. And then understanding what those funds are used for, and then using them for those funds. For example, there are 5 or 7 tranches of ARPA funding. 2 of them, one of them is about vaccine, one is about continuous testing, one is revenue replacement, and some is a maintenance of effort as well. So I think understanding what they're for and using them for those purposes, I think they can all contribute towards an expansion project as well in their own way, as long as you can justify using them for their specific appropriated purpose. So I think in that case, we work closely with our IHS contracting officer when we make our application as to what we can use those funds for as well. And OUIHP and Rose Wiaki does a great job as well, working not only with the UIOs, but also with the contracting officer in the areas as well, if there's an issue of understanding what these funds could be used for. Next slide. Oh, I guess I'm to the end, and I don't know if I went over, but I can take any questions. Guess I'm not used to chat either. Let me see if there's anything in the chat. Oh, nope.
Yes, please feel free to come off of mute as well if you have any questions for Mr. Murillo about that amazing presentation. All right, let's check our chat box. We'll give a couple more seconds for people to ruminate on this amazing presentation as well. Thank you so much. And while we're waiting, let's place some applause in the chat as well for that awesome presentation. Any questions? All right, let's check our DMs and see what's coming through. Oh, okay. How about this one? Let me keep the chat box open just to make sure that I don't talk over anybody here. But what are some barriers, maybe challenges that you came across when marketing, for the new facilities? Like, was there something that maybe like tips and tricks that you would want to share for that?
Well, I think for us, it's establishing a network of, because we focus on American Indians, Alaska Natives when we move into a new site. One of the one of the things is getting people to know what a UIO is, that we're available and we focus on providing care to American Indians, Alaska Natives. And so it's really getting people to understand what a UIO is, because in that instance, we were moving to basically a new population that still had access to the IHS direct service site. Plus also in that area of town, there is the Gila River Healthcare Corporation that belonging to the Gila River tribe, which is just south of Phoenix on the east side. So there's been places for them to access it. So really just an introduction of what a UIO is. So we try and get into like the parent program, the American Indian parent program at school districts and other things as well. So I think that's always a challenge, to let people know that we're coming and that we're on our way, and that we like to see them and provide care for them, and there's no strings attached, and it's not a trick or a gimmick.
Awesome. We do have another question in the chat from Donis. So when highlighting a community member, do you do it through a newsletter? And how do you decide to highlight? I love it when communities do that, as there is a lot of community members that do good work also.
Yeah, we take marketing pretty seriously here. We have a newsletter that we send out monthly, every month. I think right now we have about 35 or 40,000 folks who receive our newsletter. And that's just not in the Valley, that's also nationwide, but it certainly has an impact in the Valley. Social media is important. We have an active Facebook and Instagram. We also have a podcast and a radio show. So we do a lot of social media, but we also have a lot of community engagement. I mentioned it earlier that we feel like having credibility in the community is an important part of our success. And that means a lot of community engagement with the parent programs, the Indian Ed programs in the school districts. And there's a lot of school districts. So doing that. Arizona State University is also in that area. So we work with the American Indian program at ASU as well. So it's really getting entrenched into the community activities that they're already doing there. And we found that to be pretty successful.
Great, thank you so much. Let me see if there are any other questions in the chat before I go into the DMs. We just see a cute dog on screen too, so maybe the dog has a question as well. All right. So what are some, maybe, I guess, like limitations or you have experience when it comes to utilizing IHS contract dollars in that sense? Like, I know that you mentioned a little bit of that as well.
We haven't used IHS dollars because specifically, but we are planning to do that. We were planning to use ARPA funds for our expansion into Mesa, but now that we received that grant through the county public health, we can probably use that for. It really was a key decision now that we'll probably likely buy a new site for our West Valley Clinic. So the amount of money we're getting from the county, $3.6 million, is actually enough money to put some set aside for purchasing a facility on the west side. So our lease is ending at the end of September. We have a 5-month extension on that lease now that we've put into place for the purposes of now looking for a building to buy. And our realtor, who already knows us, is already aware of what our requirements are and has lined up 2 or 3 buildings for us to consider. So having all these relationships in place, and over time it becomes a real benefit. These decisions become easier when you know your financing, and when you know your realtor knows you, et cetera. The decisions become easier to make and less scary to commit to, because these are a lot of resources.
Yeah, for sure. And I love how it kind of ties back to like building that relationship when even when you're seeking funders, like you want to have those close relationships and those networkings and advocates as well. So I like how you brought it back to our first stop on the path, starting off in this journey. So thank you for that. Any other questions in the chat, or if you would like to come off mute and ask as well? All right, we have one more question from our DMs, I believe. So what are some tips and tricks, I'll get it right, for recruiting new staff and retaining current staff during expansion? Things that you have, utilized.
Oh, I think, through the appropriations and the funding we've received throughout COVID, whether it was Family First or even the PHS-SEF, there was always some allowance for staff. And in addition to continuing to retain staff, we did various things like give wellness packages. So, when we had when we managed to get a bunch of hand sanitizer, we not only considered our community, we also considered our staff and made wellness packages that included Clorox wipes and hand sanitizers, maybe a gift card, and some swag from our own company, masks and things like that. We've done that about 3 times in the last 2 years, where we provided those things. And part of the personnel problem, I think I'm not preaching to the choir, that retention is as important as recruitment. So not losing your staff is as important as finding staff. We were in a bidding war for folks like RNs and MAs during the pandemic, because there were such high demand, and then people falling out of the workplace, not wanting to take that risk, and for-profit corporations starting up their own pop-up testing centers and things like that. So and they were paying $25, $30 an hour for MAs, which in this market is just almost double what we were paying pre-pandemic. And so that was very hard. So we had a recruitment bonus to start, but that was paid out over the course of 6 months. So our goal wasn't to keep people for years; it was trying to keep people for 6 months. And so that's one of the things we did. And right now we're facing an issue where we're seeing the workforce coming back. We have more applicants for our support positions than we've ever had before, or than we've had in the last couple of years. But now the wages, the impact on wages. Arizona, surprisingly, is one of the states that has a enhanced minimum wage. And the impact of the minimum wage, while we don't pay anybody minimum wage, the difference is, you could work at a fast food and make $15 an hour, or you could be our MA and make $14 an hour and get yelled at by patients and doctors and whoever else. You can have a real horrible day like that, and get paid less than if you worked at Jack in the Box. So the wage pressures have been really intense lately, both amongst the raise in the state minimum wage, which now I think is at $12.50, and our competitors. The competitor force is dying down a little bit more, but the minimum wage is increasing, but also inflation as well. So we have an automatic, our COLA, cost of living adjustment, adjusts for year upon year inflation, and it hit us. It was 7%. We do December to December change, and it was 7%. So the board has to make a decision. Do we follow our general guidance of giving that out? And what was really interesting about that, and when you do these things about addressing people's wage, people who had no notion of leaving, it just really solidifies their intentions to stay when you do things that are uncalled for, that aren't necessary to keep people, but are great considerations and for their employment and their loyalty to us. So we like to do that. Some of that's part of our policy as well. The first payday we hit, our 7% COLA was like a week or two into the hyperinflation for gas prices here. And so it felt like we were immediately responsive. And so those are the pressures we're seeing on recruitment and retention. Is really about wages. Early on in the pandemic, it was about working conditions and safety. We had a lot of like counselors and even other providers that only wanted to do telehealth and have absolutely closed the clinic. But when you consider our population and people riding the bus and people without phones, there was going to be people to walk in, and so we could never ignore in-person visits, and that just wasn't going to be entirely possible for us to do. So those are the considerations we're having now. As I said, providers are still very hard, but that's been a long-term trend, especially in the areas where we've seen a large area for need is like, for example, psychiatry. Psychiatrists are super expensive, and they're also super hard to find and recruit. So, but we're sort of taking advantage of these ARPA dollars and the PHSSEF dollars to use as seed money for something like psychiatry. We can afford them for a year or two or three, using these grant dollars, especially the ARPA dollars. But at that point, we're hoping we have built a practice in order for it to be self-sustaining.
Great. Thank you so much. I think that's super helpful information. And I feel like, a lot of the peers in this room as well will really, benefit from that information. So truly appreciate you answering all these questions and giving us all that wonderful insight. So we are at time, unfortunately. So, I would love to continue this discussion because we're getting so much great information. But thank you so much to everyone for joining the Board of Directors workshops, Path, Walking, and Board Balance. We hope you enjoyed all 3 workshops: preparing Indigenous approach to writing grants, achievement, the board role in triple AHC preparation, and our final presentation, thriving, sustaining a growing facility and a growing workforce. We would also like to thank our wonderful presenters today, Walter Murillo and of course Zipporah Fuller. So round of applause to the both of them. Thank you so much for giving us that vital information. We appreciate any feedback you would like to provide about your session experience. You can complete our session survey by using your phone to scan the QR code on the slide that's up, or by clicking the link that will be placed in the chat box. Upon completion of the survey, you will have the opportunity to be entered into a raffle for an awesome mug. So to be entered, please complete the survey by Friday, April 1st of 2022, obviously, and we thank you so much. We also, next slide, please. We also have some upcoming events at NCUI that we would love for you to join. So on April 21st at 2 p.m., we have using the personal balance tool for youth self-assessment and goal development. We have on the 27th, the COVID success stories, COVID challenges, and cutting edge innovation. On May 5th, we have COVID success stories, the second session, mental health for everyone. On the 10th of May, we have COVID success stories, the HR challenge, enforcement of COVID-19 vaccine mandates, retention, and recruitment. And finally, on May 13th, we have our Peer-to-Peer Solutions Center 4-in-1 office hours May session. And also don't forget to save the date for the NCUI 2022 annual conference. That's recurring from May 24th at 8 a.m. or May 24th at 12 p.m. to 6 p.m. Eastern Standard Time. My apologies on that one. And no more broken promises, a path to health equity in Indian country. And that is our session. So thank you so much for that. We truly appreciate you here. So please, please, please complete that survey to be entered into our raffle. Again, thank you so much. Thank you, Walter. Thank you, Zep. And thank you everyone for attending and giving us your wonderful questions.